Gentlemen, let me tell you something that happened to me a few days ago in my practice here in New York. Mr. James, a 72-year-old man, came very worried. He told me he'd been unable to sleep well for months, that he felt irritable, that even his memory was failing, and when I asked him about his intimate life, he lowered his gaze and confessed something I hear almost every day. Dr. Chambers, since my wife passed away 3 years ago, I gave all that up, at my age. What's the point, right? And there's the problem, that what's the point is one of the biggest mistakes older men make. Because what I'm going to tell you today may sound uncomfortable, may even sound embarrassing to some, but believe me, after over 20 years as a urologist, I've seen the consequences of ignoring this topic. And I'm not talking about something dirty or sinful. I'm talking about health, about prevention, about taking care of your body as it should be cared for. I'm Dr. Theodore Chambers, urologist specialized in men's health. And today we're going to talk about something nobody tells you but everyone needs to know. What happens to your body when you stop masturbating after 60? Yes, just as you're hearing, and before you close this video or think, oh, this doctor, what's he saying? Give me 9 minutes. What you're about to hear can change your quality of life, your mental health, and even prevent serious problems you can't imagine. Look, I know in our culture we're very reserved about these topics, right? We were taught that talking about sexuality is in bad taste, that it's sinful, that at a certain age it shouldn't be. But I'm going to speak to you with all the frankness you deserve, from doctor to patient, from man to man, because medical science has shown something very clear. Sexual activity, including masturbation, is not a luxury or a whim. It's a health function. And when older men abandon it completely, the body starts to collect its toll. Let me go back to James's story. When I talked more deeply with him, I realized his problems weren't coincident. He told me that before his wife passed, they had an active sex life, moderate but constant. But after losing her, he decided it no longer made sense, that it was for young people, that he'd already lived his life, and little by little the symptoms began. First the insomnia, then the irritability, then he started forgetting simple things like where he left his keys. His son thought it was Alzheimer's, and that's why he brought him to me. And you know what I discovered in his test? His testosterone levels were rock bottom, his blood pressure was elevated, and he had clear symptoms of mild depression. All of this has a direct connection to the total abandonment of sexual activity. I'm not saying it's the only cause, but it is a very important factor that nobody mentions. Now, what exactly happens in your body when you go months or years without sexual activity? Look, I'll explain it simply without too much medical talk. Your brain is like a chemical factory. When you have sexual activity, whether with a partner or alone, your brain releases a cascade of substances that are essential for your well-being. I'm talking about dopamine, that gives you motivation and mental clarity, about endorphins, that are your natural painkillers, about oxytocin that helps you relax and sleep better, and of course testosterone, which in men not only controls sexual desire, but also your energy, your muscle mass, your mood, and even your memory. When you completely abandon sexual activity, these chemicals are drastically reduced. It's as if you're gradually turning off the lights in your house. At first you don't notice it so much, but over the months, everything gets darker. Dopamine drops, and you have trouble motivating yourself even for things you used to enjoy. Endorphins are reduced, and you start feeling more pain, more discomfort you didn't have before. Oxytocin disappears, and your sleep becomes a disaster. And testosterone, well, that's the key to many things. There's a very interesting study done at Harvard University with men over 65. They found that those who maintained some form of regular sexual activity, even if just once or twice a week, had testosterone levels up to 30% higher than those who had stopped having any type of stimulation. And it's not that masturbation is the source of testosterone. It's that keeping that system active helps your body continue producing hormones appropriately. It's like when you exercise. You don't create muscle from nothing, but exercise tells your body, hey, keep producing muscle because I'm using it. The same thing happens here. But here's something many don't know, and that's very important. The lack of sexual activity in older men doesn't just affect the physical, it greatly affects your mental health. James confessed to me that he felt lonely, empty, as if he'd lost a part of himself. And it wasn't just missing his wife, it was having completely disconnected from his own sexuality, from his own body. In practice, I see this almost every day. Men who come with depression, with anxiety, with sleep problems. And when I ask them about their sex life, many tell me, "Oh, doctor, what's the point?" And there's the issue. It's not just about pleasure. It's about your body needing that stimulation to stay healthy. It's like exercise after a certain age. If you stop moving, your body atrophies. The same thing happens with your sexual system. Now, I know some are thinking, but, Dr. Chambers, what about religion? Isn't it sinful? Look, I deeply respect all beliefs. I've worked with patients of all religions. But let me tell you something from my professional experience. God gave us this body to care for it, to keep it healthy. Masturbation, when practiced moderately and healthily, is not an act of unbridled lust. It's an act of self-care. It's like eating, like sleeping, like exercising. It's part of maintaining your health. I've talked with several priests and theologians about this topic, and the most educated ones will tell you there's a difference between obsession and health care. One thing is to live obsessed with sex, and quite another is to attend to your body's basic needs, to stay healthy. If you have doubts about it, I invite you to talk with your spiritual director, with someone educated in these topics. But don't let guilt prevent you from caring for your health. Think about it this way. When you have diabetes, you inject insulin, right? Is that sinful? No. It's caring for your health. When you have high blood pressure, you take your medication. Well, this is exactly the same thing. I'll tell you another case that really affected me. Mr. Robert, a 68-year-old man, retired teacher, came to my practice because his family was very worried. He'd started having episodes of aggressiveness, something that had never been part of his character. He was a calm, educated man, but suddenly he'd explode over anything. His wife told me they no longer slept in the same room because he'd wake up constantly irritated, unable to rest. When I spoke alone with Robert, he confessed he'd been without any type of sexual activity for over 5 years. His wife had lost interest after menopause, and he, out of respect and shame, never looked for alternatives. "I was embarrassed, doctor," he told me. "I thought it was for young guys, not for a man my age." I did complete tests, and indeed his hormone levels were unbalanced, but he also had clear symptoms of accumulated sexual frustration that was manifesting as irritability and aggressiveness. I explained all this very tactfully, and at first he resisted. But when I showed him the studies, when I explained the science behind all this, he understood. I gave him clear recommendations. I explained there was nothing wrong with attending to his needs. And gradually, he began to improve. 3 months later, he returned to my practice and gave me a hug. "Dr. Chambers, I sleep better. I don't explode over nonsense anymore. Even my wife says I seem like a different person." And all because he understood that caring for his sexual health was part of caring for his integral health. Now let me give you practical information, because I know many are thinking, "Okay, doctor, I understand, but then what do I do?" Look, first of all, Ideally, you do it regularly, but without obsessing. We're not talking about every day, far from it. 2 or 3 times a week is enough to keep your system active. For some men, once a week is enough. What's important is consistency, not quantity. Find a moment when you have privacy, where you feel relaxed. It can be in the morning after waking when your testosterone levels are naturally higher, or at night before sleeping when it can help you sleep better. Don't do it in a hurry. Don't do it under pressure. Remember, the main objective isn't just orgasm. It's keeping your whole system active, improving your circulation, releasing those hormones your body needs. And here's something important that almost nobody tells you. After 60, it's normal for things to change. Maybe you need more time. Maybe the sensitivity is different. Don't compare yourself to when you were 20 or 30. Your body is different now, and that's perfectly fine. What's important is that you stay connected with your body, that you keep attending to those needs. If you have any medical condition like heart problems, diabetes, or take certain medications, it's a good idea to discuss it with your doctor. In most cases, there's no problem, but it's better to be sure. And if you have a partner, ideally you should also talk with her. Often older women also have their own needs that aren't being met. You can find ways to support each other, even if not always in the traditional way. Another very important point is hygiene. Wash your hands well before and after. Maintain good intimate hygiene. If you use any lubricant, it should be water-based and without strong fragrances that could irritate. And please, if you notice any pain, burning, bleeding, or something that doesn't feel normal, come to the office immediately. Don't endure it out of shame. Now let's talk about the specific benefits you'll notice. First, your sleep will notably improve. The oxytocin and endorphins released during orgasm are better than any sleeping pill. Many of my patients report that after resuming their sexual activity, they sleep like they haven't in years. Second, your mood will change. The irritability, that feeling of always being in a bad mood, will decrease. You'll feel more relaxed, more at peace with yourself. James told me his son said, "Dad, I don't know what the doctor did, but you're in a much better mood." Third, your memory and concentration can improve. Dopamine is fundamental for cognitive function. Maintaining adequate levels helps your brain work better, keeps your memory sharper. Fourth, your immune system strengthens. There are studies showing that people who maintain regular sexual activity have higher levels of immunoglobulin A, which is an antibody that protects you from infections. And fifth, your cardiovascular health improves. Sexual activity is cardiovascular exercise. It's not the same as running a marathon, obviously, but it's enough to keep your heart active, improve your circulation, and reduce the risk of cardiovascular problems. It's also important to talk about what's not normal. If, when trying to masturbate, you feel intense pain, if you can't achieve any height of erection after several attempts, if there's blood or some strange discharge that requires medical attention, it's not something you should ignore. And speaking of prostate, this is another important topic. Many men ask me if masturbation affects the prostate. The answer is that it can actually be beneficial. Some MIT studies suggest that regular ejaculation can help clean the prostate of toxins and reduce the risk of certain infections. I'm not saying it's a magic cure, but it does seem to have a moderate protective effect. I want to be very clear about something. I'm not saying masturbation is mandatory or that you should feel bad if you decide not to do it. Everyone makes their own decisions about their body. What I am saying is that if you abandoned it due to unfounded fears, out of shame, or because you thought it's no longer for your age, you're doing yourself unnecessary harm. I want to share one last case before finishing. William, a 75-year-old man, widowed 7 years ago, came to my practice because his son insisted. He had mild incontinence problems. He got up 5 or 6 times every night to go to the bathroom, and this was destroying his sleep. After doing all the tests, we discovered that part of his problem was that his pelvic floor muscles were very weakened. And one of the ways to strengthen those muscles is precisely to maintain regular sexual activity. I gave him a complete plan that included specific exercises, but I also recommended resuming his sex life even if alone. At first he resisted a lot. He told me he felt disloyal to his wife's memory, and that broke my heart. I told him, "Mr. William, your wife loved you. Do you think she'd want to see you suffer unnecessarily? Or would she want you to take care of yourself and live as well as possible?" That made him reflect. 6 months later, he returned to my practice walking more upright, with better appearance. He told me he'd followed all my recommendations. "Dr. Chambers, I don't get up so much at night anymore. I sleep better, and I even feel younger," he told me with a smile. Look, gentlemen, what I want you to take from this talk is the following. Growing old doesn't mean giving up your sexuality. It doesn't mean you should feel guilty for having needs. Your body continues seeding, continues functioning, and deserves to be cared for in all aspects. Masturbation practiced in a healthy and moderate way is a health tool. It's not sinful. It's not shameful. It's not for young guys. If you've gone months or years without any type of sexual activity, I invite you to reflect on this. Ask yourself if you've abandoned that part of yourself for real reasons or unfounded fears. And if you decide to resume your sex life, do it without guilt, with the certainty that you're doing something good for your physical and mental health. If you have specific doubts about your particular case, if you have medical conditions that worry you, don't hesitate to seek professional help. A good urologist can give you personalized guidance. And please, share this information with your friends, with other men your age who perhaps also need to hear this. But don't dare to ask. The more we talk about these topics naturally and with scientific basis, the more men will help to live better, healthier, fuller lives. Remember, caring for your sexual health is caring for your integral health. Don't neglect it out of shame or mistaken ideas. Your body will thank you, your mind will thank you, and your quality of life will notably improve. If this video was useful to you, if you learned something new, leave me a comment. I'd love to know your opinions, your questions, and if you know someone who could benefit from this information, share this video with them. Often the right information can change lives. Take good care of yourselves, gentlemen, and remember, growing old isn't stopping living, it's learning to live with more wisdom, more dignity, and more self-love.